Would you recommend that practice of, you know, maybe interrupting to let them know, like, hey, we could go longer, and but it'll result in this code? Like, would you recommend that for everyone, or just is that kind of just like a general tip?
Yeah, that's a great question. And, there's many different styles of practice, and every therapist, psychologist, psychiatrist will sort of know their nature. Do they tend to do well with keeping people posted on how much time is left? Or do they also get lost and sometimes need help knowing where they're at in the session? And when you work with kids, right, kids don't necessarily tell time. And
Right.
just like with your own kids, you want to, hey, we've got 15 minutes left for this. We've got 10 minutes. And I'm someone whose style tends to be working pretty hard to keep people aware of the time, but we've definitely have strategies where you can buy countdown clocks that are green, yellow, red, which can be a nice visual cue both for the therapist and the patient. One advantage of telehealth sessions is that you always have the clock on your computer screen, which makes it easier for both the therapist and patient to know how much time there is. But I do think it's very important to set clearly, what is the length of your standard session. And if you think about it from the time codes for the CPT code, the range is 37 to 52 minutes. Theoretically, you could tell patients, if you're billing insurance, our sessions are 37 minutes. Because if I see you 37 minutes or 52 minutes, I'm getting paid the same, and that's a 15-minute difference. And it's in general confusing. It can be a hardship to accept insurance, so that can be a decision that's totally reasonable to make. You just have to be clear and upfront about that with your patients.
Right. I did want to follow up on something that you said earlier about how providers could check what other people are charging in their area. How would one go about trying to figure something like that out?
It's probably not as complicated as it seems, but most clinicians in a given area certainly have colleagues or friends who are doing different types of practices. There are insurance transparency laws now where insurances have to post the reimbursement that they provide for different codes, albeit it's very complicated to dig out those numbers sometimes. But it's pretty easy to just do a search of providers in your geographic area. And not everyone posts their rates on their websites, but there are a decent number of people who do provide their rates right on their websites. And in addition, it just by asking around through local support, organizational groups
Right.
for regional groups of marriage and family therapists or psychologists or a general psychiatrist or child psychiatrists. You want to see what your peers and colleagues are charging and setting as their charge master.